This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh and we're going to be talking about how to deal with pain. We're going to have a chance to sit down with Dr. Randall Shultz, who's a physiatrist here at Aurora, and he's going to talk about some of the options available for pain treatment. Well, thank you for joining us today. I want to start out just by kind of describing what is a physiatrist and what do you do?
Physiatry is a specialty. It's also called physical medicine and rehabilitation. And our training is the non-surgical management of individuals with disabilities. And what I focus on are individuals who have disabling spine conditions, typically herniated discs, spinal stenosis, arthritis in the joints in the spine, and the joints close to the spine. But very often that overlaps into evaluating people who have hip and shoulder problems and so forth also.
I would imagine it takes some special training for that.
Correct. Our training is fairly broad. Right after medical school, we have a 4-year residency. And some colleagues of mine, they specialize in things like rehabilitation of head injury or rehabilitation of patients who have spinal cord injuries and are paralyzed. What I specialize or subspecialize in is more the non-surgical treatment of individuals with spine problems that are generally painful.
Mm-hmm. I would imagine most people would want to avoid surgery if at all possible, and that's where you come in. What is conservative care for neck and back pain?
Anything non-surgical would be by definition be conservative care. Chiropractic treatment is a form of conservative care. Taking medications is also conservative. A lot of individuals who have spine problems benefit from services such as physical therapy. And then what I do is, in addition to ordering physical therapy and medications for individuals with spine problems, we often do a variety of different diagnostic and therapeutic injection interventions for patients. Injections that often help alleviate pain, but also help determine where the pain's coming from.
Yeah. Are there other treatment options available for people in a non-surgical way?
Yes. One of the things that often we do is work in conjunction with chiropractors and physical therapists, because what I do with injections to help determine where the pain's coming from often enables a physical therapist to more effectively treat a patient, and often helps a chiropractor help manipulate joints and get joints moving in a more normal fashion.
You've mentioned injections a couple of times. What kind of injections do you perform?
Well, I do basically all the different injections that you can think of in regards to spine problems. The most common injections that I do are epidural cortisone injections, and that's putting medication in the space between the bone and the nerves in the spine. Many people have heard that word epidural because women often have anesthesia placed in that area when they're in labor, because you can numb up the nerves that go to the uterus and make labor contractions less painful. Well, we're not inserting anesthesia in the epidural space. We're putting an anti-inflammatory cortisone in that area. And that often decreases swelling by the nerves and decreases pain by doing that. And there's a couple different ways we can deliver the medication into the epidural space. We can either go into the middle of the spine and between the vertebrae, or we can go along the outside of the spine. Then we also do injections along the joints in the spine. Often the joints become arthritic and painful, and so we will inject the joints at times with Novocaine and cortisone to decrease inflammation, and that often helps for an extended period of time for people who have joint pain. Sometimes what we'll do is put radiofrequency probes along the outside of the joints and permanently numb up the nerves that go to the joints. That's called radiofrequency facet ablation. We also do injections that put medication by specific nerves in the spine. We call those selective nerve root injections. And often we need to do that in order to diagnose which nerve is affected by whatever pathology there is in the spine. And finally, we often do what are called sacroiliac joint injections, which are joints that are really at the base of the spine. Often people think those joints are the hips, but they're really joints just down real low, and they can get arthritis and they can generate pain, and injections often alleviate that for patients.
Some complicated stuff in there when you're talking about the joints in the bones. At what point, if a person is dealing with some discomfort, some pain, should they come and see a physiatrist like yourself, or should they go see their primary care physician first?
The majority of spine conditions don't even require my services initially. 80% of episodes of acute back pain, for example, 80%, which is a high percentage, are going to get better with time, chiropractic treatment, and medication, and relative rest within a 1-month period of time. Typically, I see people who have either much more severe incapacitating pain that might start suddenly, but is a sign of a more serious problem, and I will see them early on. But I would say very often the patients I see are after that 1-month time frame, where they might be in the category of the 20% of people that aren't getting better, and then they require help from me.
Mm-hmm. And then for those, you're able to help a lot of people, but if it's even more serious and surgery is required, your group is able to help them as well?
Correct. Myself, I do the non-surgical aspect of spine care for patients that are referred to us, and that doesn't always work. Unfortunately, people often do need to consider surgery, and surgery does help these people. It's just that many people look at that as a last resort. Surgery is probably done on about 20% of the people that are referred to our clinic. 80% are treated non-surgically. But our surgeons are very, have a lot of expertise and a lot of training in treating all the different spine conditions that are out there.
All right. Well, we thank you for taking some time with us today.
Well, thank you.
Now, if you've been dealing with some pain, you can always check in with your primary care provider, but if you have other questions about pain and pain treatment, you can get a hold of Dr. Shultz here at Aurora at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.